it seems like we have been talking about technology and data and intelligence, etc., for a number of years now, and it seems like nobody has really taken that leap yet, and now it really needs to happen.
No, I think that's absolutely right, because if you look at the situation today with some of these blockbuster drugs, and even some of the challenges that we see with machines and the lead times on those machines, it's becoming more and more difficult to increase capacity. So you have to find some way to shift capacity or get capacity now that you don't have for 2 or 3 years, because of these new machines coming towards different companies who order them. I think there are two issues though that are associated with it, are driving this kind of challenge, if you want, even more so. The first one is the machines that today are becoming incredibly complex, and if you look at when I first started in injectable medicines, 600 a minute was a high-speed machine. Today we're talking about machines for delivery at 1,000 a minute. That means that the complexity in just the mechanics, but also in the data management and the management of the machine it makes these very, very complex, and that therefore means it's difficult to commission them and manage them. But with that increased complexity, maybe solve some problems. You can do more things with one machine, but that also means that the lead time for a machine, where it might have been 2 years, is now 3 or 4 years. And so the question then comes is, how do I offset that kind of shortage, or how do I offset that challenge of these machines and the complexity? I think it also helps, though, if you're in a drug shortage situation, like some companies, with blockbuster drugs, the need to drive more volume, more manufacturing capacity out of your existing machines means that people should look back and sort of retrofit, rather than, as you say, waiting for the new technology and the new machine. And if a small percentage increase in production capacity could make a huge difference to some of these companies that are challenged with drugs and drug shortages.